Good health, bad health, health inequality. What determines it? What are the social determinants of health? The most important and trusted way in defining health is the medical model. We concentrate on the absence of disease and that this is affected by genetics or even individual lifestyle. However, World Health Organization describes it as the physical, psychological, and social well-being of a person where individuals have a control over one's life. They are determined by the social and environmental conditions you live in. The more socially disadvantaged you are, the more likely you live an unhealthy life. In fact, your early childhood, your access to education, socioeconomic status like income and levels of stress, and even housing, like social housing, that impacts on oneself. It seems like something unrelated to health, but hear me out. So, what is social or public housing? Social housing is a short and long-term rental housing that is provided to the most vulnerable people by non-for-profit government or non-government organizations on the basis of need. Okay, so what is poor social housing and what are the effects on health? Poorly maintained, unstable, and moldy walls with leakage leads to lack of sanitation and cause severe physical issues such as skin and respiratory infections or asthma. It also causes psychological distress as living in social housing is highly stigmatized. It impacts on self-esteem and contributes to negative views on the self, especially neighborhoods with entrenched disadvantage where people were associated with crime. Unsafe neighborhoods leads to more fear of crime, leaving people with higher levels of anxiety, limited social interaction, higher chances of developing mental illnesses, and making it hard to obtain secure employment. Then, what is good social housing? Good social housing with high quality and aesthetics in a safe area results in lower stigma, more motivation, and rather elevated sense of pride. Outdoor green space provides opportunities for social interaction, community cohesion, and a sense of belonging and reduces distress. Bonding with people in similar circumstances or even just good heating systems generate an environment for overall well-being.
Now that we understand the link between health and housing, we can look at an example. The building behind us is called Sirius. It was created in the 1970s as public or government housing. It has 1, 2, and 3 bedroom units inside to create a mix of older and younger residents. It's fully accessible and each level has access to an outdoor area, which we know is really important for health and well-being. It has a number of common areas throughout it to create a sense of community.
These are also important factors for tackling stigma and social exclusion, which is important to health and well-being. There's been a lot of research done which finds that people who are in the private rental market are affected by a lot of anxiety, especially older people who feel that they might be evicted. And that's why buildings like Sirius are so important for social housing.
Since 2014, successive governments have attempted to pull buildings like this down and gentrify the entire area of Millers Point. A lot of people they've been moving out of these areas have been older people, and we know that moving people away from their community is detrimental to their health and well-being. The campaign for Save Sirius is trying to get this building heritage listed. So while it won't ever be social housing again, it's important that social workers join the fight to say to governments that we care about our social and cultural heritage, and that we want more buildings like this that encourage greater health and well-being for the people that use them.
This is one campaign happening in Sydney at the moment, but there are many. It is essential that as social workers, we join the fight and advocate for social housing, which is appropriate and maintained for the diverse amount of people accessing it.
So yeah, go visit Sirius or check the campaign out on the website, Facebook or Instagram, and yeah, join us to save our Sirius today.